Africa is the only region to have developed a unified continental strategy on COVID-19, and that strategy has delivered results. Although our continent has suffered, we have not yet seen the same scale of devastation in Africa as we have in some other regions. We have seen an encouraging decline in cases and deaths since the peak in mid-January. However, several countries in the continent continue to report sustained transmission and increase in some areas.
Welcome to Global Health Matters podcast. I'm your host, Garry Aslanyan. You just heard from Dr. Tedros, the Director General of the World Health Organization, mentioned that Africa has not seen the same scale of devastation from COVID as a result of a unified continental response strategy. In today's episode, we explore some of the reasons why African countries have been able to deal with COVID so effectively. These reasons range from a prior experience in dealing with epidemics such as Ebola, strong sub-regional research networks, and long-standing investments in research capacity. In today's episode, I'll be joined by Dr. Thabi Maitin. She is the manager of the Division for Research Capacity Development at the South African Medical Research Council, and by Dr. Paul Kazyoba, who is the research scientist and director for research at the National Institute for Medical Research in Tanzania. Our guests will shed light on the COVID-19 response from each of their countries' perspectives. Welcome, Thabi and Paul.
Thank you, Garry.
Thank you, Garry.
So let's start. Maybe we can start, Paul, with you to let us know what has been the research response to COVID in your country and how has this developed in the last year?
Thank you, Garry. Thank you so much for the opportunity. The scientific community has a role to play, and in fact, research has a key role to provide guide and direction how we should go about responding. So what we did as researchers, we convened a meeting immediately after the first announcement, where we resolved to develop what we called a rapid response research agenda for COVID-19. That was the very first undertaking so that we are able to contribute in the national response efforts against COVID-19. So we developed a national research agenda for COVID-19, covering several aspects from epidemiology to interventions, risk communication, and so forth, whereby different disciplines were brought together to provide inputs on how research can contribute in the response. The agenda was adopted by the ministry. I remember it was in the second week of April, so it took us about 3 weeks to have it done, and the ministry endorsed it, and that became the guide and one of the tools in the response against COVID-19. Immediately thereafter, I remember we about 3 or 4 projects were undertaken in the country, where my own institution did 3, and our national hospital implemented one project. So suffice to say, we have been part and parcel of the response effort. I serve in the National COVID Response Committee, me and the Director General for NIMRI, and we provide briefings every time we have a new project which is addressing COVID-19, and see how the results from there may contribute in the fight against the pandemic.
It's impressive that you've been able to develop a unified national research strategy in 3 weeks. Thabi, was the response by South African research community the same?
You know, Garry, I find it so interesting what Paul has said, because in a way, I would say perhaps there's an echo between the African countries. Obviously, I can't speak of all the countries, but what Paul is saying resonates with what happened in South Africa. With South Africa, the government took a very strong lead in making sure that information dissemination was paramount. just to contain the situation, while obviously the researchers were sort of aligning their processes how they would be. But what I found interesting and extremely efficient was how the government formed this committee, or an advisory committee. This advisory committee was formed by heads of institutions of research. So, for instance, the Medical Research Council, of which I'm part, other institutions such as the leading immunology centers in the country, what shall you say, externally funded entities. So I think that brought about a level of confidence to the populace that, okay, we've got the government is worried about this and is taking the correct steps to get experts to be the front runners in the intervention. There was this lag phase before people actually believed that this is real, this is happening. What I found interesting in the approach that the government took is what it echoed to me what seems to be the recipe for success for doing research in Africa. If you want success, you probably have to involve the government in a very, very strong way. And that has happened in South Africa, even though obviously the experts are given their space for advice and so on. So the experts that were in the front line were people that could just easily do a segue into the COVID space. So that's where we are. I can safely say that there is extremely robust research that is going on. But I suppose that's a different node to our chatting.
We have observed that many countries seem to adopt a top-down response to COVID-19, in contrast to more bottom-up approach taken in Africa, which was more inclusive of researchers and communities alike. Paul, would you say this was true in case of Tanzania?
Yeah, it's true. As you said, it's when you look at the European and American, of course, and some other continents, many nations adopted a top-down approach to responding to the COVID-19. In Tanzania, if I'm to speak for my country, we actually adopted bottom-up in the beginning, bottom-up approach, and this was deliberate because if you want to have the community or the population responding well to the preventive measures, a sense of inclusivity is key. And when you look at the bottom-up approach, it means you are inviting different groups of people with their ideas to contribute towards the fight against an enemy of the time. So we saw religious leaders playing the key role. Traditional medical practitioners also had their role. Scientists had their role, and so forth and so forth. At the end of the day, the impact was very positive in terms of calming down the panic, as my colleague Thabi has said. That is very key if you are to win the fight. And again, that helped us a lot when it came to implementing a few projects which we are focusing on community engagement, such as risk communication, adherence to some of the government directives, especially on preventive measures, etc., etc. However, toward the end of May, we adopted a mixed sort of approach, and that was as a result of reshuffle in the Ministry of Health. So the management, the permanent secretary, was changed. The chief medical officer was also changed. So these two guys who are the key technical lead in the health sector came in with a different thinking. So they brought some sense of top down. So we had mixed sort of approach. When you look at the community level, it is bottom up. When you look at the technical, it became top down. So then we, in the technical, we had to listen what these guys are saying and then see if it connects with what we are thinking in terms of technical. So that was the time when there were so much red tapes coming in. But I'm happy to say the community engagement remained the same. And to me, that was key. For us who are on the technical arm, we had to realign with the thinking because the direction was changing. So that was the difference. But the first 2 months, honestly, we really enjoyed the bottom up. Researchers were busy. Traditional healers were also doing their business. Religious leaders were also doing their business. So combining some sort of triangulated effort, and at the middle you have the government, we saw a lot of impact. And then all of a sudden from June, things changed. And that changed a lot of things up to early this year.
I recall from a project we worked with EDCDP after the major Ebola outbreak, how important it was to involve all stakeholders in response. Paul, how did prior epidemics prepare Tanzania to deal with COVID-19?
We have had some dengue outbreaks. We have cycles of dengue in this country. Every after a year or two, we have dengue outbreak. And dengue also do bring a lot of panic, especially in the community where the cases are reported. And then we have learned a lot from Ebola. The Ebola outbreak contributed a lot to the strengthening of response capacities of many countries, especially for some of our countries which are very close to, are in the lake region. As you remember, before COVID-19 outbreak, we had Ebola in Congo. And Congo and Tanzania were just close. So when the world was fighting Ebola in DRC, in Tanzania, we were busy preparing ourselves for response. So we had drills, we had a lot of simulations and so forth, lab